So I accidentally stopped that last video instead of continuing this video. So sorry, the first one was kind of short. The next thing, hopefully I won't make that mistake again. But what we're trying to do is, what I'm trying to show you is to focus in on the presynaptic nerve, the synapse, and the postsynaptic nerve or muscle or whatever is the next thing. So normally what would happen is the action potential, which I know you all love, the electricity goes this way. There are stored neurotransmitters and what are called vesicles or little packages of neurotransmitter. But the action potential comes down, the neurotransmitter comes out into the synaptic space and will go on top of receptors that will affect the next neuron or skeletal muscle or smooth muscle, whatever kind this is. And then eventually, some of that neurotransmitter is repackaged, which is called reuptake, into the previous or presynaptic nerve, and some is broken down by enzymes that are in the synaptic space, because eventually you want to clear this out so that you can get another signal. And that's what drugs do. They either change presynaptic nerve output, like they increase it or decrease it. They act like neurotransmitters, so they act like agonists, like we've talked about with other medications. They block neurotransmitters, so they're antagonists. They increase reuptake, so they make the nerve, they either decrease or increase reuptake so that this action here where the previous neurotransmitter goes back up, or they affect the enzyme that's supposed to break the neurotransmitter down. So all of the actions of drugs in the system do something here between the presynaptic nerve synapse and the next spot. The first part of the autonomic nervous system, or the nervous system that you don't have control over, that's responsible for your involuntary actions, is the sympathetic nervous system, which is the fight or flight response in the body. So it's our response to stress, and that stress is really most appropriate, or this system is most appropriate to help prehistoric people whose biggest stress is dehydration, starvation, or trauma. So this causes the pupils to dilate. It's slowing down digestion, so there'll be decreased salivation, decreased GI motility. Heart rate goes up, vasoconstriction, and bronchodilation. This is all about getting oxygen to the brain, and then a decrease in urinary output. So if someone is taking a medication that activates the sympathetic nervous system or acts like the sympathetic nervous system, that person is taking what's called a sympathomimetic, meaning it is miming or acting like the sympathetic nervous system. And if it's doing that, it's acting on adrenergic receptors, so it's an adrenergic agonist. And we know that the sympathetic nervous system receptors are the alpha and beta receptors. So if I look at this list of things that occur with activation of the sympathetic nervous system, and I might be giving the patient something that activates the sympathetic nervous system, I can see on this list that there are certain people that we have to worry about if they take these types of medications. And there are some important instructions we need to give people regarding these medications. So, pupil dilation. If your pupils are dilated, it's good. It does help with with distance vision and can increase visual acuity, which is why it's part of the fight or flight response. But it adds some concerns. One is a driving concern. So if my pupils are dilated, that's really best for seeing at night. So what type of people would have to be worried when they were driving? What time of day would be during the day? Because if I am unable to constrict my pupils while I'm driving with full bright lights, then I'm not going to be able to see very well. It's going to be blurry. So people would have to worry about daytime driving. The other condition that we would have to worry about or tell people not to take the medication is glaucoma. So we haven't really talked about that, and I don't know if you've talked about it in other classes, but glaucoma is a condition in which the pressure in the eye increases and puts so much pressure on the optic nerve the person can go blind. So pupil dilation can actually change how the eye processes the fluid inside and potentially increase pressure in the eye. So if a medication favors pupil dilation, then people with glaucoma need to be careful about taking it and might not be able to take it. So we're worried about day driving and glaucoma. So the person has decreased salivation because we're not worried about digestion during the fight or flight response. So that means they're going to have a dry mouth. And so as the nurse, you would instruct them on things that would help increase fluid in the mouth or decrease the dry mouth. So increasing fluid intake, sucking on candy, stuff like that. Peripheral vasoconstriction occurs because you want to shunt all the blood to the brain, because the brain has no ability to save anything and is completely weak. We would sacrifice our entire body for our brain. So it'll cause vasoconstriction, and we know that'll bring the blood pressure up. So immediately we know that there are a group of patients that we have to worry about, those patients with hypertension. Because if it's not very controlled and we give them a medication that acts like the sympathetic nervous system, that might bring their blood pressure up. Bronchodilation, that's fine. If they have asthma, great. It's really not too much we have to worry about. Increased heart rate, tachycardia, that's to try to circulate more oxygen, especially to the brain. So if the patient has a history of dysrhythmias, we'd have to worry about it. But the other thing is, what if the patient has a history of coronary artery disease? Remember, those were the patients that we talked about in the cardiovascular unit that we don't want to put extra stress on their heart because they can't take it. So if I increase the work of the heart, I might cause angina or potentially a heart attack. So those patients you have to use caution with. Decreased GI motility or activity. That's because we've not focused on digestion right now. So those people are obviously at risk for constipation. So if we know that's going to happen, then we can tell people the same thing we told them when they were taking opioids. In order to decrease constipation, they should increase their fluids, increase their fiber, increase their activity. This part can sometimes be tricky for people to understand in terms of GI motility and urine output, because sometimes people will be like, well, I'm super nervous. Whenever I'm really nervous, I have to go to the bathroom and I have diarrhea and I have to pee. But that's like initially when everything relaxes because we're not using that anymore. Usually what happens is it's difficult to urinate because it's really not time. Like I don't really want to go in a bush and pee and poop if it's time for me to be running away from a saber-toothed tiger. That would be really stupid. I would just be eaten. So the body slows these activities down. This part is especially hard for people to understand because what it does is relaxes the bladder muscle. And people will say, well, if I relax the bladder, then it should be easier to pee. But it's not relaxing the bladder, it's relaxing the bladder muscle. So you have to think back to the anatomy of the bladder, which I know you have memorized, right? So here's your bladder. It has a muscle on top of it called the detrusor muscle. when you want to urinate, you have two sets of muscles, and then here's your external sphincter. This bladder muscle is under involuntary control because it reacts to the parasympathetic nervous system, actually. This external sphincter, thank the Lord, is under your control because you don't have to urinate the minute you feel the sensation, you can hold it. So if the person's bladder gets full and the bladder gets stretched, that sends a message to the brain, and the detrusor muscle will start to relax. It'll give you the sensation that you have to urinate, and the parasympathetic will cause this muscle actually to contract. And when this muscle contracts, it puts pressure on this external sphincter so the person feels like they have to go to the bathroom. And then if they relax the sphincter, they'll be able to urinate. So if I relax the bladder muscle, I might have the sensation that I have to urinate because the bladder has stretched, but I am unable to urinate because the bladder can't contract. So the person could feel like they have a really full bladder, but they won't be able to go. So who would have trouble with this? Well, somebody has difficulty urinating to begin with, and that is always those men with a benign prostatic hypertrophy. So if someone has a big prostate right here, and it's always hard for them to urinate, and they always have issues with urinary retention, and then we make it harder for them to urinate because that muscle can't contract, then they're going to have even more trouble. So there's another group of people that we have to worry about. So we have to worry about glaucoma patients, hypertension, coronary artery disease patients, or benign prostatic hypertrophy patients, and if anyone already has decreased GI motility, if they have obstruction or some other kind of problem, you have to worry about them. So that's the kind of thing that would be on the quiz, would be what are the actions of the sympathetic nervous system, and what teaching or people do I have to worry about if I'm giving medications, sympathomimetics, that act like the sympathetic nervous system. So then the other side of the autonomic nervous system is the parasympathetic nervous system, which is the rest and digest, which I want you to be sure to remember that that doesn't mean that all rest is occurring. It just means our priorities have changed. Now, we're not dehydrated or starved or running a saber-toothed tiger or a victim of trauma. We are actually able to digest our food and take care of the body's other metabolic needs. So it is still an active time. It's just a different activity. This acts on what are called cholinergic receptors, and the main neurotransmitter is acetylcholine. Drugs that act like the parasympathetic nervous system are parasympathomimetic, which is a fun word to say, but basically means they're miming the parasympathetic nervous system. So what can we expect if the parasympathetic nervous system is activated? The pupils are not going to dilate, so they're more likely to constrict, and it's harder for them to dilate. There will be more salivation because that's important for digestion. Digestion starts in your mouth. Heart rate goes down, less vasoconstriction, so your blood pressure goes down. Don't favor bronchodilation anymore. In fact, it would be hard if we needed to allow that to occur. Increased GI motility so that we can digest our food, and increased bladder activity so that this is now the time that we can go to the bathroom if we needed to. So now we have to think again about our patients that might be taking medications that affect this. So if I can't dilate my pupils, then I have to worry about night driving, because I need to dilate my pupils at night in order to see. Increased salivation, not usually an issue for too much stuff. Decreased heart rate, so that's bradycardia, so if you have bradydysrhythmias. Decreased vasoconstriction, so the blood pressure goes down. So for this system, if the blood pressure is down and the heart rate is down, that could change the patient's blood pressure, so it could favor orthostatic hypotension or be an issue that way. Bronchodilation, decreased we're unable to bronchodilate when we need to. So people with asthma are going to have to worry about being on these types of medications, because if they're having an asthma attack and we want them to be able to bronchodilate, they might not be able to. GI motility increases, which could mean diarrhea for the patient. So we have to be sure they're aware of that and are getting enough fluid so they don't get dehydrated. Increased bladder activity means that the bladder muscle will be able to contract. So we have to go back to our picture. So let's say now we're back to the bladder picture with the detrusor muscle and then the external sphincter. So here's the detrusor muscle. If I increase or allow contraction of the bladder, then the patient will be able to urinate once they relax the external sphincter. So we know already there's patients we have to worry about. One is people that have incontinence. If the person already is losing urine and we make their bladder more active, they might have increased urinary incontinence, which would be upsetting, obviously. If the person, we still have to worry about the benign prostatic hypertrophy patients, which you think like, why? I thought we were better that way. Well, if I have something that's blocking the flow of urine and I keep contracting the bladder, it doesn't make it easier for the urine to come out. It just is more painful. So that's still a problem with these types of medications. So this, what we're doing right now is reviewing adrenergic and cholinergic, or sympathetic and parasympathetic. And this is very, very important. This is going to come up in a bunch of test questions. It's going to be on the quiz. You should keep doing this, practicing over and over again, drawing pictures of it. The best way is to take a piece of paper and divide it up like this into 4 squares. The top square is the sympathomimetic, the sympathetic nervous system medications, the adrenergic medications. They will cause dry mouth, constipation. We have to worry about people who are driving during the day, and we have to be careful about people with coronary artery disease, glaucoma, and benign prostatic hypertrophy. Hopefully, you'll be able to kind of keep reminding yourself that we're decreasing salivation, decreasing GI motility, increasing pupil dilation, which makes it hard to see during the day, increased heart rate and increased blood pressure with someone with coronary artery disease means we're putting more work on that heart that's diseased, glaucoma because of pupil dilation, and benign prostatic hypertrophy because of relaxation of the bladder muscle. Whereas cholinergic medications are the medications that are parasympathomimetic, or acting like the parasympathetic nervous system. So instead, we have to worry about diarrhea and night driving, and it might alter their heart rate and blood pressure, which potentially could impact their heart function as well. And we still have to worry about benign prostatic hypertrophy because we increase GI motility, don't allow pupil dilation, decrease heart rate and blood pressure, and we are potentially overacting of the bladder muscle. This doesn't improve benign prostatic hypertrophy, in fact, makes it very uncomfortable. So now you see here, there's these 2 open spaces. What are those for? Well, it gets a little more complicated after that, so hopefully you have a good handle on that. Because here are medications that activate the sympathetic nervous system, but we already know there are medications that block the sympathetic nervous system, and those are anti-adrenergic. We have blocked the alpha and beta receptors. Which means we are closer to a cholinergic response. We're closer to the parasympathetic nervous system. Even though it's different receptor activity, if I block sympathetic nervous system activity, I'm more like the parasympathetic side. And so I have to worry about the parasympathetic stuff, like increased GI motility, decreased heart rate and blood pressure, worrying about driving during the nighttime, and worrying about benign prostatic hypertrophy. The other people we have to worry about potentially are the asthmatics, who might not be able to bronchodilate as well in times of stress. So anti-adrenergic, sympatholytic, or blocking the sympathetic nervous system, is similar to activating the parasympathetic nervous system. The other side would be anticholinergic medications. These medications will be like adrenergic medicines, but instead we're blocking cholinergic receptors. So we're acting on different receptors, but if we block the cholinergic response, then we're parasympathetolytic, meaning we're not acting like the parasympathetic nervous system, and instead are closer to the sympathetic nervous system, closer but not as strong. So adrenergic and anticholinergic are similar in terms of their possible side effects, as well as people to use caution or cautiously or contraindicated. And anti-adrenergic and cholinergic are similar in terms of potential side or adverse effects, as well as cautions or contraindications. So I recommend listening to this part of the video multiple times and trying to duplicate this from memory multiple times, because this is going to come up over and over and over and over and over again. Will be the quiz material and will also be on the exam. The other division of the nervous system that we talk about in terms of medications is the somatic nervous system, or the skeletal muscle, the voluntary nervous system. So this is within our control. We have nerves that branch off the spinal cord that innervate our skeletal muscle in order for muscle contraction to occur for movement. So those somatic nerves also release acetylcholine that act on cholinergic receptors, but these receptors are on skeletal muscle. When these receptors are activated, then we allow calcium into the muscle so that muscle contraction can take place. So it is a type of cholinergic receptor. So when we use medications that are cholinergic or anticholinergic, we also have to think about what possible effects there might be on the skeletal muscle. Because every time we use medications, we always have to remember that they're not exactly as selective as we would like. So say we only wanted to affect the parasympathetic nervous system, not the skeletal muscle, but sometimes that's just not how it works. And we can actually end up affecting the skeletal muscle as well. So keep that in mind.